Now please listen here. So what we were discussing in our earlier classes is actually regarding the different type of WBC and also about RBC, then a little bit about platelets. Now this is another important topic, that is blood coagulation. What is the mechanism of blood coagulation? Probably you can expect questions on this topic. So about blood coagulation, also known by the name blood clotting, it is a process of forming a clot to stop bleeding. So when there is some injury or bruises, there will be blood coming out of your skin, and after 5 to 10 minutes you can see that there is the blood leaking is actually stopped, the bleeding is stopped. And here body is has taken a mechanism known by the name coagulation, and during a coagulation or blood clotting, a kind of clot will be formed, and clot is actually fibrin thread. And we have to understand how this mechanism is working. Objective of coagulation or clotting is to convert plasma protein fibrinogen into fibrin. In our plasma there is a protein. Normally that protein is existing in a liquid form or in a soluble form. Okay, so during clotting, this soluble protein, the protein that is normally present in a soluble form, will be converted into an insoluble form or into a solid form. That is, liquid will be converted into solid. That kind of mechanism is taking place, and as a result, this fibrinogen, normally in a soluble form, will be converted into number of solid threads. They are like a net, and in that network or in that net, a lot of WBC, RBC get trapped, and a small cap-like structure will be formed at the site of injury. So this is how normally this blood coagulation or clotting is taking place. Now blood cells and platelets become stuck to form fibrin, resulting in a mass. That was what I am telling. Then before this step is going on, body is actually depending on three other processes. First process is vasoconstriction. Vaso means blood vessel. Constriction means contraction. So as a result of this contraction or constriction, the size of the blood vessel, of the diameter of the blood vessel, will be greatly narrowed. So from a larger diameter, it will be converted into a smaller diameter, so that less blood will be coming to that region and less blood will be lost from your body. So that process is known by the name vasoconstriction, which simply means contraction of the blood vessel, so that less blood will be actually lost from your body. When injury occurs, valves constrict, causing reduced blood flow to the site of injury. Now another mechanism is something known by the name platelet plug formation. I think somewhere here, I think I have shown you this platelet plug. Here you can see that. So what happens is that thousands or hundreds of platelets will come together to the site of the artery, and they will stick with each other, and as a result of that, a plug-like structure or a cap-like structure will be formed that will be sealing the opening or sealing the injury. So that is what is happening in case of platelet plug. Platelets aggregate. Aggregates means come together to the site of injury. They stick with each other, acting as a plug. So that is why it is known as a platelet plug formation. So this is another mechanism. One is reducing the diameter of the blood vessel, so that less blood will be coming. That is one mechanism. Another mechanism is platelet plug formation, which I have shown you here. This is the platelet plug formation. As a result, also some amount of blood flow can be prevented. But still, the more effective method. See here, you can see how the vasoconstriction is. This is the normal size of the artery. When vasoconstriction is this inner wall or inner diameter is reduced, so the little blood will be coming through that. So here you can say platelets will be, so in case of platelets plaque formation, many platelets will come together and attach with or stick with each other. Now platelets, these two mechanisms may not be sufficient to prevent the complete loss of blood. So that is where the third mechanism known by the name clotting or blood coagulation is coming into the picture. Now here what is happening is that the formation of clot depends on number of factors. There are a lot of proteins in your blood and these proteins are playing an important role in the final conversion of fibrinogen into fibrin. Actually clotting means fibrinogen into fibrin. But for that mechanism to operate or to work, there are many other proteins are needed. Some 13 or more than 13 proteins are needed. These substances are, or these proteins are together known by the name clotting factors. Here I will show you these are the 13 different proteins which are involved in clotting. So they are operating in a stepwise manner and each protein will be activating another protein. So here in a stepwise manner these 13 proteins are working together and finally converting the fibrinogen into fibrin. So that is what is happening. So that is known as, so these substances are known by the name clotting factor. So if there is a question, one mark question, what do you mean by clotting factors? Proteins which are playing an important role in facilitating blood clotting are known by the name clotting factors, and they are designated by Roman numeral 1 to 13. That is how they are normally written. And these factors activate each other in what is known as clotting cascade. The meaning of the word cascade is actually waterfall. So in a stepwise manner, this clotting factors are operating, about which we will be seeing. The end result of this step is that fibrinogen will be converted into cleaved or split into fibrin. Fibrin is actually a non-soluble plasma protein. Fibrin proteins stick together to form the clot. So that is what is happening in the final stage of the clotting. Conversion of fibrinogen into fibrin will be taking place. Now, for this conversion of fibrinogen into fibrin, there are two mechanisms. One mechanism, or we call it by the name pathways. One pathway is known by the name intrinsic pathway. Another pathway is known by the name extrinsic pathway. That is what we are now discussing. Extrinsic pathway and intrinsic pathway. Extrinsic pathway is activated by external trauma. If there is an injury on your hand, that is an external trauma. And that causes blood to escape from vascular. So that as a result of external trauma, you will be losing blood from your body to the outside. that is so it is a more serious case rather than the internal trauma. This pathway is very quicker than intrinsic pathway because there is a loss of blood from your body is involved. So to prevent that loss of blood, the body is acting very fast. That is a peculiarity of extrinsic pathway, and it involves a number of factors. One important factor is the clotting factor 7. You will see what is clotting factor 7. Clotting factor 7 means pro-converting. The technical name of the clotting factor 7 is known by the name clotting pro-converting. Now another factor is another kind of pathway is known as intrinsic pathway. Now intrinsic pathway is activated by trauma inside. Trauma means any kind of injury inside the vascular system. Vascular system means blood vessels. So inside the blood vessel, if there is any kind of injury, then that will be causing intrinsic trauma. And here and is activated by platelets, exposed endothelium, chemicals or collagen. These are the substance that is normally triggering intrinsic pathway. So that means on the inner side of the blood vessel there is some deposition of platelets. That can be a trigger, that can be a stimulation for intrinsic pathway. Now here the importance is that this is a slower pathway. Here this one is a faster, very faster, because loss of blood is involved. But here there is no such a loss of blood. It is within the blood system itself, but still it has to be prevented. Then here you can see that four factors are involved: 12, 11, 9 and 8. 12, 11, 9 and 8. I will tell you the name. So what is 12? 12 is actually Hageman factor. 11 is plasma thromboplastin antecedent. Then 9 means plasma thromboplastin component, PTC and PTA. The two different terms are there. One is antecedent, one is thromboplastin component, and one is also present anti-hemophilic factor. That is the eighth factor. So these are the different type of clotting factors or proteins which are playing a role in the clotting process caused by intrinsic pathway. Now, whether it is intrinsic pathway or extrinsic pathway, there is a last final pathway. Whether the clotting is starting by extrinsic pathway or intrinsic pathway, finally it is reaching a common pathway. In that common pathway, these are the factors which are involved. One is 1, 2, 5 and 7. You will see what are the. One means fibrinogen. So as a result of the common pathway, fibrinogen will be converted into fibrin. So one is involved. And for converting this fibrinogen into fibrin, we need prothrombin. Prothrombin is the enzyme. Prothrombin will convert, prothrombin is will be changed into thrombin. Thrombin is the enzyme that convert fibrinogen into fibrin. So second factor is also needed. That in addition to the 5 and 10 are also needed. What is 5? Proaxelerin is the fifth factor. 10th factor means Stewart factor. Stewart factor. You might have heard about that in a cartoon character Stewart. So just like that, Stewart factor is also there. Then proaxelerin. Proaxelerin is the fifth factor. So these are the four factors which are involved in last pathway. So there are three pathways. One is actually caused by external injury, other due to internal irritation or something, and that will be known as intrinsic pathway. But both are actually moving to the one common pathway. In that common pathway, these are the important steps. The most important steps is the conversion of fibrinogen into fibrin. That is the end effect of all this pathway. And here this is sometimes known by the clotting cascade. You know, you just arrange several cards one after one behind the other. When one card falls, then their cards will fall. So it is like that. So that kind of system is known as a card cascade. So blood clotting involves multi-step process known as a coagulation cascade or clotting cascade. And here you can see that up to 13 proteins are involved also. And these proteins are operating in a stepwise manner or like a chain reaction. So that is the most important peculiarity. And in general, each step produces a new protein and which act as an enzyme or catalyst for the next step. So here also the same thing. Now you can see how this mechanism is actually operating, the coagulation cascade. You see the first one, what is intrinsic pathway? Intrinsic pathway is the internal injury. So in case of damaged surface, our inner surface of this blood vessel is damaged due to some reason, then that will be triggering 12th factor into active form of 12th factor. That is, which is the 12th factor? Here you can see that it is the plasma thromboplastin antecedent or PTA. That is normally in an inactive form. That will be converted into an active form during this step. Then that will be triggered working on that active 12th factor will be acting on 11th factor. Which one is the 11th factor? That is plasma thromboplastin that is plasma thromboplastin antisense. 12th factor is actually Hageman factor. I got it wrong. So 12th factor is the Hageman factor. When act is activated, that will activate plasma thromboplastin antisense. Then what is happening is that this 11th factor will be working on 9th factor. 9th factor will be converted into active form of the 9th factor. This active form of the 9th factor is the plasma thromboplastin component PTC. So that is the 9th factor which will be converted into active form of the 9th factor. The A is indicating active form, and that will be working on 10th factor. 10th factor is, I think it is Stewart factor. An active form of the Stewart factor will be developing, and that active form is finally responsible for converting prothrombin to thrombin. See, the conversion of prothrombin to thrombin is actually developing from active Stewart factor, and for that another enzyme is also needed, that is the proaccelerin. 5th factor known by the name proaccelerin. Here you can see that is the proaccelerin. So proaccelerin and Stewart factor together combines prothrombin to thrombin. Okay. So, and when thrombin, what is thrombin? It's basically an enzyme. That enzyme converts fibrinogen to fibrin. You can see that. And when fibrin is formed, there is another substance. There is, here you can see 13 fibrin stabilizing factor. See, that last one is the fibrin stabilizing factor that is responsible for cross-linked formation, forming a stable clot. So it is with the, even if fibrin is formed, this 13th factor is also needed. So 13th factor is helping in actually forming a net-like structure to be formed by the fibrin. So that is the 13th factor, and as a result of that, fibrin will be converted into fibrin threads. In this fibrin thread or net, lot of RBC, WBC platelets will all get trapped, and a solid cap-like structure or a plug-like structure will be finally formed that will be sealing the injury. So this is the mechanism here. Now in case of extrinsic factor, the procedure is simple. Only one is that is 7th factor. 7th factor means pro-converting. So that will be converted into active form of the 7th factor. Here you can see that. And as a result, the Stewart factor or 10th factor will be activated. Then it again works on thrombin to thrombin. Thrombin will be working on fibrinogen to fibrin. So whether it is starting in the intrinsic pathway or extrinsic pathway, both are actually coming to the same pathway. That is why it is known as a common pathway. So by common pathway, it simply means it is a final pathway. And see, here you can see that everything is happening in a step by manner. One is triggering other is triggering the next one. So that is why it is known as a clotting cascade. Now we have to see now about this. So today we will stop here. There are few diseases which we will discuss in our next class.